Nutrition Hero Podcast. Igniting both the art and the science of functional medicine. Here's your host, Dr. Brad Watts.
Hello, ladies and gentlemen. Welcome back to the Nutrition Hero Podcast. I'm Dr. Brad Watts, your host, as always, sitting in a podcast lab today. And I gotta say, I just got done with the most amazing conversation with the clinician who is our guest today. And I think you guys are in for a real treat. Oh my goodness. It's so good. I'm not even going to say anything. So good. So today we have a special guest. His name is Dr. Terry Trinka. He is a doctor of optometry located in the southwest suburbs of Denver, Colorado, and out in the mountains there. And what a great gentleman, great provider, and the information that you're going to hear today, I think you're really going to enjoy. So we'll get after that. Quick detour here before we get to it. If you are new to the Nutrition Hero Podcast, make sure that you are subscribing. Hit thumbs up. Thank you for participating with us. And by the way, all of you that have been sharing the Nutrition Hero Podcast lately, I appreciate you as well. So thank you for sharing with your colleagues, your friends, and family. And anybody that is interested in natural health and healing, interested in what it might look like to have a lifestyle that's compatible with health and healing, my goodness, thank you for sharing with them. So, all right, without any further ado, let's welcome in Dr. Terry Trinka. Dr. Terry Trinka, welcome to the Nutrition Hero Podcast. Thank you, sir, for being here.
Pleasure to be here, Dr. Watts.
How you doing today?
Awesome. I'm ready and willing to talk about anything you want to ask me.
All right. Well, I'm excited for this because you have a different viewpoint than most people I get to talk to. And you're coming from the viewpoint, however ironic this sounds, the viewpoint of the eyes, right? And the eye-brain connection is your tagline for your practice. And so I'm excited to delve into this today with you from a nutrition perspective, from a neurologic perspective. Before we do, would it be all right if we get a little bit of background on who is Dr. Trinka, and how did you end up as a doctor of optometry in the nutrition world? What is that like?
So it was actually reversed. I was an eye doctor and pretty comfortable knowing what I knew and not knowing what I didn't know. That's a big issue right there.
That is, yeah.
and so, you know what you know. And I was just doing family practice, and I had a patient come in who overwore her contact lenses and developed a corneal ulcer that was teeming with bacteria on her cornea and eating through her corneal surface. And she came to me and said, "What do you want to do?" And I said, "Well, Sandy, I want to give you an antibiotic because you have the potential of losing your vision due to the corneal ulcer." And she goes, "Well, I don't believe in antibiotics." And I was stunned. I'm like, yeah. Why are you in my office?
Right.
And she said, "I just wanted to know what it was." And I said, "Well, I have an obligation to you because you came into my office. I have to follow up with you. Would you please come back in, I think, a day and a half is when she could come back earliest time." Yeah. Well, long story short, she came back and it was almost gone. And I looked at her and I said, "What did you do?" And she goes, "Oh, I used some homeopathic remedies." I'm like, "What are those?" I have no idea. Like what? All of a sudden my head exploded. So like what? And so she says, "I can tell you're intrigued. There's a meeting of the Denver Homeopathic Study Club next Monday at the library about a block away. Why don't you show up?" So I did. And I was so impressed with what I heard that I decided to study homeopathy for about 3 or 4 years. And then I decided, I don't want to be a homeopath. It's all encompassing. If that's what and they were talking about classical homeopathy,
yes.
Where you're doing 3-4 hour intakes and stuff like that.
Right.
And that's all good. And for the people who want to do it, I think it's wonderful,
right.
To find the classical homeopathic remedy for a person. But it opened up my eyes. And all of a sudden I started thinking, oh, there's more to being a practitioner than what's better, one or two.
Yeah.
And so
How long ago was this?
That was in the early 90s.
Okay. Wow.
And so I thought, well, okay, what am I truly interested in? And food was always just amazing to me because it's not only about nutrition. It's about culture, and it's about peer pressure, and it's about convenience, and it's about all these other psychological and mental, maybe even spiritual factors that had to do with food.
Absolutely.
And so I thought, I've got to get more educated about that. So I went and got a degree as a nutritionist, and I've been doing practicing clinical nutrition since about 1999.
Wow.
And so I've been doing that. And then I was still doing, pretty much primary care optometry and nutrition. And well, in the early 2000s, I was doing also functional vision, which has to do with vision therapy and things
Okay.
like that. But I had a series of events that with people. So if you do vision therapy, you have to have vision therapists, right? Because
Right.
you as a doctor don't have the time to do that. And I had a series of events where I went through about 3 or 4 of them, and I go, this is just such a hassle.
Mm.
And I like the work, but I wanted to just do nutrition. So I delved into that. I've met the most amazing people in the nutrition field. And I'd have to say, you're one of them.
Oh, well, thank you.
I have to pay a little homage to your podcast here because it's one of my favorites.
Oh, thank you.
I know some things, but I always learn something when I listen to your
Mm.
podcast. So I think it's just awesome. The work you do, I'm a big fan.
Well,
So,
thank you.
but
I
I,
appreciate it.
sure. But I've just met an amazing amount of clinicians who, when Edison talked about his discovery of the light bulb, he was fairly deferential, and he said, I stood on the backs of giants. And I feel the same way. People that are much smarter than me, I've learned a tremendous amount from. So I did that until about 2014. And then a bunch of chance circumstances, maybe not so much chance, right? I started to get involved in neurooptometry and learning how to help people neurologically through their eyes. And
Mm.
that's what nutrition and neurooptometry is what jazzes me the most right now.
Wow.
I'm obviously well prepared to handle people with glaucoma, macular degeneration,
Yeah.
cataracts, floaters, things like that. And that's the domain of primary care optometry typically.
Okay.
However, I love my profession, but
Mm.
I think they're slow to adopt new technology.
You're just preaching to the choir here, man. I'm a chiropractor.
Of
So
course.
that's
And
great.
so, and I'm not. I want to know what is the fastest way that I can help a person.
Yeah.
And well, even forget about fast, most effective. And
Mm.
sometimes the most effective is not the fastest, it's the
Mm.
hardest. And sometimes it can be really easy. But the fact that the eye is connected to every system of
Mm.
the body makes me want to say, how can I affect the rest of the systems of the body through the eyes? And there's
So
all sorts of examples.
that's amazing. So the type of patient that shows up in your practice, and once you learn something, obviously it's really hard to turn off, right? Like you can't
Well,
unsee
yeah,
what
you
you've
can't
seen.
unknow it, right?
And so you have a patient show up in your practice, and you're looking through this lens of the eye brain connection. And what types of cases are you seeing? Are you helping people with like learning disabilities, or are you
No
talking
question.
about
Yeah,
like endocrine
just
dysfunction? Like what's going on there?
a whole shooting match.
Okay.
Um, you can affect thyroid function, for instance, with syntonics, which is the fancy way of saying light therapy. Syntonics is a group of dedicated optometrists that have been using different frequencies of colored light since I believe they started in the 1920s. And
Really?
formally, yeah, it's been amazing. And no one knows about it.
No,
And
so I'm gonna ask. So
they've been
explain how that connection works. What's going on there?
So two ways. There are pathways. For instance, there's a retinal circuitry. So let me back up a little bit.
Hmm.
Traditional optometry strives to make charts clear and check the health of the eye. I mean, that's what they do.
Yeah.
They make charts clear up close, far away, so that you can navigate your world, and they make sure you don't have any disease process. And that's important, Dr. Watts.
Yeah.
That's a good thing to do. However, I think that's just a foundation to jump off from, because the circuitry that goes from your retina to your eye involves so many other things. So 90% of the retinal signals are going to go through through the laterogeniculate nucleus. It's going to go to the visual cortex, and you're going to have an image forming event occur. That's fine. That's great. There was an optometrist in the 50s by the name of Skeffington, and he started to say, hey, there's more to it than just making images clear, because you have to get involved with your environment, and your mind is involved as well. And so it was really funny. He lived and worked in the middle of the country in the cornfields. And these farmers would come in and they would not see the chart clearly, but they had really no problem. They didn't, complain or anything. He'd give them glasses, and they'd come back and throw the glasses at him and say, hey, I'm plowing my row's crooked. What the heck? And so he started to realize it wasn't all about making the chart clear. And so there's that pathway that goes from eyes to visual cortex, but there's a ton of other pathways. So there's one that goes directly to the hypothalamus. And in the hypothalamus, there's something called the suprachiasmatic nucleus. And that suprachiasmatic nucleus is loaded with connections to the pineal gland and melatonin for sleep. There's another pathway. And so back to Skeffington. He said that it's not only about this question of what is it. So that's what eye doctors are doing. You're identifying a letter on a chart, right? And so it's an A, it's a D, it's a whatever, right?
Yeah.
And it's fuzzy or it's clear or whatever. And that, he says, is the what is it pathway. So the what is it pathway is 90% of the neurons that are coming out from your retina. But there's these other pathways that are ultra important, like where is it?
Right.
Like if you don't know where it is, you don't know what to look for, right?
Right.
So, and that's a whole different pathway. That's called a Magno cellular pathway, and it involves a different set of neurons. There's another set of neurons, like I was talking about the hypothalamus before for pineal and melatonin, that has to do with a very unique kind of retinal cell called an intrinsically photosensitive retinal cell, otherwise known as an IPRGC. And that, all this stuff never gets addressed in a traditional eye exam. So you have a what is it pathway, you have a where is it pathway, and one of the most interesting things is the where am I pathway. Because if you don't know where you're at in space, you pretty much don't know where things are. And if you don't know where things are, you're going to have difficulty identifying detail. So, you see how you build this hierarchy?
Absolutely.
And then there's this other part called how am I? And this is how light therapy really plays in. So if you're stressed and tired or angry, how do you think your visual perception is?
Yeah,
normal?
Probably not awesome.
No, probably not. and so this is the how am I pathway. And this is where light therapy or syntonics has so much to do with. And you can influence these pathways by colored light, which is one of my tools. I generally have 4 tools. And it's, to me, when a person comes into my office, I'm always thinking traits and tools, traits and tools. So what do I mean by that? Traits, who is the person sitting in front of me? I mean, and again, this is far beyond optometry or eye-brain connection or nutrition. It's for everybody who's doing a job that's trying to help a person in front of them.
Yeah.
Who are you? Right. Who are you? How do you perceive the world? Where's the imbalances? How can I influence them in the most gentle and effective pattern, the way that you can do it? And these are all the things that come into my mind. So traits, what's going on with that person? What's their story? And tools. In the optometric world, I have 4. I can use tints, I can use lenses, I can use prisms of 2 different kinds, and I can use occlusion. So sometimes I can stimulate the retina in a very specific pathway to affect brain function.
Mm.
For instance, there's a little bump in the back of your brain called the superior colliculus, and that there's a visual map of the world in the superior colliculus. Well, right underneath it, and so I can send signals there to affect posture, which I think is phenomenal. If I can do that, I can change how a person's neck tightness is just by a lens. I can change the position of their hips. And I see that. And so I work with chiropractors all over or physical therapists, because they'll reach a plateau. And one of the jobs that I have is to say, how can I help the practitioner who's referring a patient to me so that they can do their magic? Because everybody runs into plateaus, everybody runs into walls, and you're like, okay, why is this person not getting better? Well, what's the dominant input into your brain? Vision, like by a long shot. And so if there's something messed up in the pathways between the eye and the brain, then you're only going to get so far. So I can affect how the posture is just by glasses. That's crazy, right?
That is crazy. I've never heard this stuff before. Like, I've seen some things, but I've never heard this before. This is amazing.
It truly is. And there's one final part to this questions of visual perception. So that you got where is it? You got what is it? You got how am I? Where am I? And then here's the last one, and potentially super interesting. And that is, how do I describe it? How do I talk about it? How do I communicate about what I'm viewing? And that's what I call the eye-ear connection. Dr. Watts, have you ever seen a person who, when they get visually intent, miss auditory details?
Yeah,
or
right here.
vice versa. Vice versa. Yeah, like every wife would tell a husband, "You're not listening."
Right, I could think of 3 or 4 just yesterday.
Or vice versa. They're intently listening and they miss visual details. Well, below the superior colliculus, of course, is the inferior colliculus. Guess what the inferior colliculus is all about? Auditory. And so there's these giant connections between vision and hearing, and most people have no idea. And so this, I was taught this by a wonderful doctor in Chicago by the name of Dr. Zielinski. And she's pioneered this kind of work between eyes and ears. And I love it because you can help people in a way that's profound. I have a story about this. In fact, I have lots of stories, but I'll just choose one. Okay.
Yeah.
So I went to her office to go learn more about connections between the eye and the brain and the mind and all the rest of this stuff. And they were having a party for her because she had done 20 years of doing this work. And she invited a lot of her patients there to help celebrate. And these parents had kids who had seen Dr. Z. And one of the guys came up and he said, I had a kid that my son went to kindergarten. After the first day, the teacher called and said, hey, I think there's a problem with your kid. And he's like, the first day of kindergarten? Are you kidding me? Like, what? What in the world? And she said, I think there's something wrong. I start talking and he's looking at the ceiling hole tiles, the holes in the ceiling tiles. And I was like, there's something wrong there. And she said, I think you should have your son's vision checked and his hearing checked. Well, he did that. And of course, these are traditional exams, right?
Yeah.
So you get your eyes checked and it's like, can you see the chart on the wall? And get your hearing checked. Can you hear this tone? And everything checks out fine. And he's like, well, it's not that. And so meanwhile, his son goes from kindergarten to first to second, third, and is miserable at school, like last in the class. Bad. And he's a smart kid. And so finally, one of his friends said to him, you got to go see Dr. Z. And she does her magic and gives him a pair of glasses and says, wear them in school, not on the playground. And so the dad takes his son to the kindergarten, or I think it's about 3rd grade by then. And then the teacher says, well, great. What are the glasses for? And the dad looks at her and says, to help his hearing. Like, what?
Yeah.
So long story short, he starts wearing the glasses in school, and they get changed a couple of times, and he gets better and better and better at school. Well, when I was out there, he graduated from high school in the top 10th of the top 1% in math in the world.
Huh.
Yeah, crazy, right?
That is crazy.
Intervention, that kind of intervention changed that kiddo's life. And
well, not just his. Imagine what he's going to go and do with that skill. How
right?
many other people are impacted by that?
Yeah, the ripple effect, right?
Yeah, wow.
So there's an eye-ear connection that's super important, as well as an eye. And I mean, it's really an eye-brain connection. It's just part of the brain that's connected to the ear, and part of the brain that's connected to balance, and part of the brain that's connected to the autonomic nervous system. How many docs out there have patients that are imbalanced in the sympathetic and parasympathetic?
Exactly. I knew you were going to say that, because that is the problem.
Right.
So
it's
amazing.
insane. And that's you can quiet down a nervous system so that with these tools, these occlusion tools, these lens tools, these prism tools, and these color filter tools, so that the person can move to the next stage of healing. And I've listened to enough of your podcasts to know that you're an enormous believer in the power of healing inside the body and get rid of the interferences. And so that, I believe, is one of the jobs that I do. I try to get rid of interferences that are kind of mucking up the system, so that the naturopath can do his or her job. The chiropractor can get a better level of success. The acupuncturist, the nutritionist, the body worker, because there's sometimes interference with the brain. So that's, I mean, when a person walks in and they've got neuro issues, I kind of light up. I was like, oh my, this is great. And it's not great because they're hurting, right? I mean, they're there for a reason, because they're not doing well. But internally, my sense of being wired to help people gets turned on, and my intellectual sense gets turned on. I'm like, oh, how can I help? There's got to be an imbalance here somewhere. And so oftentimes I'll send the person back to the doctor that referred to me, and give it some time, and all of a sudden that person's at another level. Or if they're not being referred, they're just coming to me on their own, then I'm able to help them in a neurooptometric way. But because I also have a clinical nutrition degree, I'm always looking to say, what's the impact of the rest of the body on the brain, specifically the gut?
That's right.
Oh my goodness. I mean,
so just from like my brain thinks in schematics, okay? And so if you are looking at somebody that's coming to you with, let's say, a learning disability, or they've been diagnosed with a learning disability, and maybe it's not actually a learning disability, maybe it's just inability to focus on what it is they need to be focusing on, right?
Exactly.
And so you have this top-down approach, eyes, brain, and then impacting whatever physiology is from there. And then you also have a bottom-up approach, which is using the nutrition, and you're basically meeting in the middle, so to speak. You're bookending the problem and squeezing them together, so to speak.
And trying to find out where the problem is.
Yeah.
Is it? Okay. And so you try different things. Yes, learning disability is a patient population that I see. And sometimes you can get after a little bit of that with just traditional optometry. Although I think come on, Dr. Watts, the eye chart that was developed by Snellen, 1862.
Yeah.
Has our world changed just a hair?
Just a little. Just a little.
Wait, I want to hunt.
Yeah. Isn't it amazing that is still in use? It's a static, letter-based eye chart. Yeah. When is the last time a kid
high
looked
contrast
at a static image?
I know, they're swiping phones. It's the digital world. You go drive and things are flying past you on either side. There's a total. So the big black machine that they put in front of your eye to make the chart clear. It's called a phoropter. What does it do to your peripheral eyesight? Completely takes it out of the picture.
Yeah, it's gone.
You're like, what? What?
See, I'm sensitive to this right now with like learning disabilities and stuff like that. I have little kids that are in grade school and their classmates, I mean, I hear stories almost every day, and classmates that are struggling or classmates that have, special things they have to go and do because they literally can't calm their body for 8 minutes in the morning to listen to what the teacher has to say. Right. And it's an
Oh,
amazing scenario.
it's
In my brain,
completely
I see
true.
all the different chemical things that are winding it up.
Sure.
But it's interesting to see, which I think is like a base up approach, but it's interesting to see the top down and the base up come together in what we're talking about today. I just
Exactly
wanted
so.
to, yeah, it's amazing.
So I have a couple comments on that.
Yeah.
So just to, because you're seeing it, and maybe a trace of education for the people listening
Yeah.
is when I deal with a person that's smart but's not doing well in school, and there's I'd say about 20%.
Mm.
That's a high number.
Mm-hmm.
20% of kids are smarter than they show in
Ah,
school. And school is just a visual way of learning, right?
yeah.
School's not very auditory. It's
Mm.
not very kinesthetic. It is without question visual. And if you have all your visual ducks in a row, you're probably going to do okay in school.
Mm.
But there's no guarantee that you just because you're born and you go through development that you're going to have that. So
Right.
I make two kind of distinctions in the beginning when a mom or a dad brings a kiddo into me and said something's going on. They're not reading well. They hate reading. And I was
Yeah.
like, how do you hate reading? It's like theater of the mind.
Yeah.
Like what's going on there? And so there's these elements that I want to just cover. Number one is there's a smooth muscle in your eye called the ciliary muscle that controls the shape of the lens of your eye that allows you to see things up close.
Mm.
Well, you and I both know that smooth muscle is under the control of the autonomic. And
Mm-hmm.
so if you're being chased by the bear, how much do you want to
Right.
look up close?
Right. Not
Not
much.
very much.
Yeah.
And how many are there a bunch of reasons for, your overly sympathetic person, fight or flight
Mm-hmm.
person? Yeah.
Well,
So that's
especially a
number one.
kid in 2021.
Absolutely. Of course. Not to mention diet, the stress of peer pressure, all the rest of that
Yeah.
stuff, the toxicity of the world that we live in, blah,
Yeah.
blah, blah. Right. I mean, yeah, again, preaching to the choir, I know.
Adults that are trying to kill you with coronavirus and all stuff.
Yeah, right. And who is really that person behind that mask?
Exactly.
Like, wow. Talk about amygdala being fired
Right.
up and fear. Oh my
Wow.
goodness.
Exactly.
So that's number one. So if they can't focus, how can they be a good student? And focus is a multi-layered word, is it not?
Mm-hmm.
There's focus in terms of ADD, ADHD, which I think is, well, I won't get into too many opinions on that because
Sure.
I'm not a big believer in the medications.
Mm-hmm.
Or if I am, it's only for an extremely short amount of time while you try to figure out what's going on.
Mm.
And I think that maybe it has a place there, but most often it's like there's another brain-based reason why that person is the way they are. So number one, focus. Number two, can you make your left eye and your right eye move in to converge on a screen or on a book? If you can't do that, the amount of symptoms that you have are crazy. Like the words jump and they move and
Yeah.
and sometimes they double. Like I sometimes take a parent and I'll put some prisms in front to imitate what Johnny is looking at. And they're like, oh my God, I can barely read.
That's
I'll ask
amazing.
them, what did you just read? And they're like, I have no idea.
That's
Because these,
that is amazing that you'd think to do that in that type of a scenario. Think of the connection that allows between the parent and child.
oh
Just
yeah.
the understanding that they're building bridges where there's just been frustration. Oh my goodness. Okay, sorry to interrupt.
No, and it's so true. I mean, and they're just looking for help, and they would like to have homework be a 20-minute scenario, not an hour and a half of screaming and crying.
Mm-hmm.
And it's so unnecessary if you
Mm-hmm.
get the right help. Just like you would say for all the different professions that you talk to,
Mm-hmm.
so unnecessary if you get the right help. So
Mm-hmm.
okay, so we've got focusing, we've got convergence, and then we have, can you move your eyes from one place to the next in an accurate manner? We would call that oculomotor or tracking.
Mm-hmm.
And there's all kinds of ways to look at tracking. A lot of, I know a lot of chironeuros,
Mm-hmm.
and they have many tools in this area. I've got one of them. It's called the right eye, and there's 4 infrared sensors on a screen, a digital screen, and you follow things with your eyes, and then it records what's going on. And it's so much better than the eye doctor taking a wand and saying, "Hey, Johnny, follow my finger," or
Right.
in like doing the physiological H,
Yes.
or something like that. You can get it. I mean, sometimes even that comes through. You're you're saying, "Hey, follow my finger." But here's something that's really interesting. And this is for all the docs out there. So when you do your exam and you choose to say, "Hey, look at this while I'm moving this," ask them a question to engage mental effort
Mm.
while they're doing that. Say, "Can you spell clock backwards?" And you'll see their eyes go all over the place. And so my question would be, should you be able to track and think at the same time?
Probably.
Probably.
That's, my goodness.
So,
Yes, this makes sense.
those are 3 really basic things that almost all good functional optometrists are going to do, which are, by the way, only 20% of the large group called optometry. So you have a 2 in 10. If you refer somebody to get their eyes checked, you have a 2 in 10 chance of getting somebody who's going to look past the chart clear
Yeah.
and eye health. So
Yeah.
you want for sure to refer to a functional optometrist.
Wow.
And then in that group, there's neurooptometry, and then strange guys like me who like nutrition and theology and biochemistry and
That's
things
right.
like that. Okay, so those are the 3 things that go on an eye exam. If you see difficulties, about half the kids that have problems in school have neurodevelopmental problems.
Mm.
And so these are kids that they cannot project right and left on their body into space.
Mm.
And so if they have that, lowercase d's and b's are always messed up.
Mm-hmm.
And they're saying dog instead of bog or whatever.
Right.
And so that can interfere with reading and what could be called a learning disability. Here's another one. Most everybody I know knows what Where's Waldo is.
Right.
Right. That's called figure ground. So what is reading? It's picking out a very small part of symbols on a mass sea of symbols. It's just like Where's Waldo. If you don't have a figure ground capability that's good, reading's going to look like a giant mess.
Mm.
So that's a visual developmental thing that if everything goes okay from birth to age 6, then you're cool. But that doesn't happen all the time. And so you have to do these developmental exams and look for right and left, which we call laterality, and the projection of right and left into space, which is called directionality. You got to look at figure ground. What about the card game where you have these images on cards and you flip them upside down and you try and match them, called the memory game?
Right.
I mean, do you really want to sound out the every time you see it as a kid? I mean, you have to have sight words and memorize them, right?
Right.
And so this is another issue. So visual memory. There's another one called closure. So if you see something that's not completely the figure,
Mm-hmm.
and you can kind of fill in the gaps, that's another critical part of reading.
Mm.
And so I see all of these things happen. And if they're missing 1 or 2 of these things, they're just not going to be a very efficient reader, and reading's going to be tough for them. So it takes somebody to look at this and figure out what's going on. Add in there's something that many chiros are aware of called primitive reflexes.
Mm-hmm.
And so these reflexes are in the infant as they come down the birth canal. And as the neurodevelopment of the infant happens, these primitive reflexes get dropped. And sometimes, especially when a person gets hit on the head, these primitive reflexes can come back. And that's what they call retained. So you have these retained primitive reflexes, and these retained primitive reflexes interfere with the neurodevelopment of the kid. And so, and I've seen it in adults. They get into a car accident or fall off a horse. I live in the mountains, and so people have horses up here. And all of a sudden, these primitive reflexes start coming back out, and they interfere. Well, I just dealt with a 10-year-old who's a great baseball player, but he's miserable in school. He fell off a horse, hit his head, and he's got a retained primitive reflex that interferes with his tracking. He can't track very well. And I went to the right eye and tracked him. I was like, yikes, he's in like the 19th percentile. And he's struggling in school. And mom's trying to figure out why he's struggling in school when he's good at baseball and he's smart. He's got a retained primitive reflex because of the TBI, because of the concussion that he had. So you have to look at neurodevelopment, you have to look at visual efficiency, and you have to look at primitive reflexes. So that's the kind of top down. And then the nutrition for me is the bottom up.
Right.
Like, what's going on with your gut? Oh,
yeah, I was going to say, I know you're a gut guy. You're a gut guy. You like to start there because of I would imagine, because of the entrance. It's like basically a big gateway to the rest of the body. And can you describe some of the things, because you brought up TBI, can you describe some of the changes that take place in the gut while you're looking at a patient that has had a recent TBI, something like that, like this kid who's the baseball player?
Well, you can't guarantee anything because people fool you all the time.
Sure.
And the more you know, the more you don't know. So it's exceptionally easy to be humble in trying to help people. And the minute you think you puff out your chest a little bit and you got an ego and you think you know something, then somebody walks in and you're like, I know nothing.
That's right. That's one of the great parts about this podcast, by the way, is I get to talk to people all over the country in different specialties. And the more people I get to meet like you and discuss things like this, I'm like, oh my goodness. Right. Oh goodness, this is amazing.
How much do we not know? It's really funny. So in a TBI, of course, as soon as you get a concussion, you have a leaky blood-brain barrier. And I have an opinion about this. I don't want to necessarily fix the blood-brain barrier on day one. I don't think that's such a great idea. I think the body's ability to try to heal itself, to allow chemical mediators to come in from the bloodstream to help heal that barrier, are really important. Now, if it starts to last, we got a big issue. And you know the equation probably better than most people do. And that is leaky gut equals leaky blood-brain barrier. The two go together. And so you're going to see the same thing. And so we normally look at it in reverse, right? We normally look at, you eat crazy food and you have a crazy microbiome and you have a crazy amount of toxicity. And so you're poking holes in your gut. And guess what happens to your blood-brain barrier at the same time? You're going to poke holes in it. And so you're going to allow stuff into your brain that has no business being there. But it can also go the other way. So you can hurt the blood-brain barrier. And as a result of that, you can also have a leaky gut barrier. And, you know, what percentage of people have a leaky gut barrier to begin with in America?
Right. A truckload is maybe
3 truckloads.
So there's a mimicking effect that can happen bottom up, which we're all familiar with, but that top down mimicking effect,
also,
that's interesting.
And of course, when you start talking about, and this is my challenge as a nutritionist and a neurooptometrist, is I have to be able to talk about lifestyle. I have to, and oh my gosh, here's the master that I'm talking to about lifestyle plus genetics equal chronic health outcome. How many times have we heard that out of your mouth? And it's so, and the only reason why is because it's so true, right? It's like, it's a given. And so this is the part that's the most difficult. If you're going to see somebody and you have a nutritional problem, you kind of think, I bet they're going to talk to me about changing my diet. I bet they're going to talk to me about exercise. I bet they're going to talk to me about sleep. And of course, that's true. But when I'm seeing a neuro candidate, they're not as well prepared to hear that conversation. And so this is my challenge to say, look, this is an integrated whole. Your brain just doesn't exist as a vacuum, or in a vacuum.
Right.
There's massive connections. The effect of lipopolysaccharide on the blood-brain barrier is well known. The effect of LPS on the rest of the body and inflammation. Another key fact that you and I both talk about a lot is inflammation. Mm-hmm. And To me, there's a lot of inflammation in people's bodies, which gets me to another topic. And that topic is how many of the conditions that I see in health, we spent all this time talking about function, right?
Yes.
I should probably touch on health a little bit.
Sure.
I mean, I have a different take on a lot of things than traditional optometry, but I also know where my boundaries lie as well. So I'm well equipped to do both, to use traditional optometry, which I thank my lucky stars that I entered into this great profession, because it's afforded me so many different opportunities to look at people and to figure out the puzzle that the person is. So let's talk a little bit about health. So one of the things that directly has to do with inflammation is a primary reason that people lose their eyesight in old age, and that is macular degeneration. And the macula degenerates. Why? Well, in the traditional viewpoint, we don't care. We don't care why. We have these heroic efforts with anti-VEGF drugs to stop new blood vessels from forming and leaking and scarring, thus destroying a person's vision. So we have shots that we put into people's eyes. I don't, as an optometrist, that's an ophthalmological procedure, right? That's a medical doctor procedure.
Yeah.
But I sure have referred a bunch of patients to people to get those shots. And I think that there's value in that, but there's also equal or possibly more value in trying to figure out, why do they have this in the first place?
Right.
Right. And so why do they have this? Well, you and I both know that there's a lot of problems with oxidation in the body and free radicals and antioxidants. And so whenever I see a person who's got the beginning of macular degeneration, I'm thinking, where's the inflammation?
Yeah.
And their genetic weak spot just happens to be their macula. It could be their liver. It could be their thyroid. It could be their pancreas. In this case that I'm looking at, it happens to be their macula.
And so, I wonder what the stats are on that. Like, what percentage of the population that has macular degeneration also has, liver or kidney
inflammation? Exactly. No one's looking at it. I mean, there's probably a handful of docs, both in the ophthalmological field and the optometric field, that feel the same way as I do. But by the vast majority does not. They want to know, and this is good. They want to access something called AREDS2. And AREDS2 was a study where they looked at different nutrients. There's a kick, right? They looked at different nutrients to see if they could influence the course of dry or wet macular degeneration. So usually by the time you get to wet macular degeneration, nutrients are not the big issue. You're using heroic efforts because the person's vision is getting destroyed. And so you're going to have to do something. But the point is, why is it there? Stop it in its tracks. And so this AREDS2 study said, well, let's look at lutein. Let's look at zinc. Let's look at vitamin C and vitamin A. And they actually found that they had a pretty noticeable effect on the progression. And so AREDS stands for age-related eye disease, AREDS. And they did AREDS1 and AREDS2. And so now you have companies that sell AREDS2 formulas in the grocery store. And of course, those nutrients are perfect.
That's right. That's right. What's the product that everybody gets for eye health from the grocery store? There's one brand name. I won't say what it is, but you know what it is. We'll leave them off of our podcast. But
thank you very much.
The point is that treating a population that has chronic disease, which is what kind of my area of functional medicine is all about. I can't tell you how many people are using that product just because it exists, right? Because they don't have any other solutions for this condition other than the anti-VEGF medications you were talking about.
Right.
Interesting.
No, it's so true. And it's there. It's in front of them. And a little bit of TV advertising and we're good. And we're good to go. And optometrists that don't have any background in nutrition.
Right.
I mean, are all vitamin A derivatives the same?
That exactly.
I mean, is thiamine just thiamine?
Mm-hmm.
Like, yikes, and
Yeah.
people don't know that. And so they'll take the cheapest form and think and it's likely that they're doing something okay for them, but it could be so much better, so much more powerful, especially if they go, well, let's go look at inflammatory markers.
Mm-hmm.
But our healthcare system is not set up to do that. And so you have to run into people who say, why are you inflamed? What's the source of the inflammation and where is it? And as you probably know, gut, teeth, sinuses.
Right.
I
mean, those are the big ones.
Yeah.
What do you typically see as far as, resolution measures? Are you seeing patients improve or just not get worse as fast as they were getting worse?
Well, it depends on what arena of tools that you use. So here's another place where light therapy can really help, because you're trying to quell inflammation and, very, very basically. So beyond all inflammation, or behind all inflammation is likely autonomic nervous system imbalances, right? Well, light therapy, its primary objective is to balance the autonomic. And so in the blue end of the spectrum, you're going to quiet down, and then the red end of the spectrum, you're going to excite. So light therapy has a place. Medical treatments have a place. Nutrition has a place. All of these things are really important. To answer your question more directly, and not be a politician.
Yeah.
I would say yes. I've seen people halt at the level that they're at. It depends, and I've seen some people gain a line or two of acuity depending on their commitment. When you think of inflammation and trying to treat inflammation, do you think of your local eye doctor?
No.
No, and you don't even think of your local chiropractor either.
Right.
You usually think of
exactly.
What steroid, what corticosteroid am I supposed to use here? And so it's a skewed way of looking at health. So that's one way. What's another really big health thing that I run into? Cataracts. Well, so are cataracts special in that they are different than any other tissue in the body? Well, in some ways, yes, because there's no vascular supply. So and I'm totally aware that cataracts are because of an oxidation imbalance.
Can you define cataracts real quick for the people that are listening?
Sure. So right behind the pupil of your eye is a crystalline lens that's and it's transparent so that you can see through it, so it'll focus light on the retina. And this crystalline lens is the focusing mechanism that we referred to earlier when little kids can't focus, because it's controlled by smooth muscle, which is under the control of the autonomic nervous system. And so this lens that's transparent is available to get oxidized, just like rust on your bumper. And so as it get oxidizes over the core, and it's really slow. So that's why you don't see cataracts unless they're traumatic in a 2-year-old. But you see cataracts in 50 and 60-year-olds all the time. And it's because of the life that they led allows for an imbalance between free radicals and antioxidants. The problem is that it's really difficult to get antioxidants that are eaten by mouth to go through the vascular system to the crystalline lens of the eye, because it's avascular. There's no blood vessels that feed it. Only when you're a fetus. And there's a little blood vessel that, like when you're in your mom, there's a little blood vessel that goes right to the lens that feeds it. But then that disappears when you're born, and you have this clear, transparent crystalline lens that's super valuable in you navigating the world up close and far away. Yeah. So over the lifetime of, I would say, less than perfect choices, whether they were intentional or not intentional, you'll see this oxidative process start to take hold. And the lens first turns yellow. That's the kind of the first type of change we see. And this is all oxidative.
Yeah.
And then it turns brown. And then you can't see no matter what lenses I put in front of you, and the chart's all blurry. And then typically you get a cataract operation where they take that one out and they put a plastic one in, and they tune that plastic so that you can see clearly far away, which in some ways is kind of cool. And in other ways, I was like, is there a better way? Do you have to get a surgical operation? And sometimes the answer is no, because you waited too long. And sometimes the answer is yes. We can use antioxidant eye drops that have things like N-acetylcysteine and glutathione. And I mean, these massive, huge antioxidant potentials, vitamin C. And so you use these eye drops and it'll leak through the cornea into the clear fluid right behind the cornea, which is called the anterior chamber and has the aqueous humor. And then it'll penetrate the lens and start to change the oxidation status of that lens. And so you can clear up some of the yellowing or clouding in the lens. To me, that's phenomenal.
That's amazing. That even just the mechanics of it, the way you were describing it, is amazing. Is that something that is readily available at pharmacies, or is that something that you have to build one off for people?
Well, I learned about this about 10, 12, maybe 15 years ago. And I've been using it ever since. And it's the special person, right?
Yeah.
It's the person that wants to do this.
Yeah.
Other people say, go away, leave me alone. I want to live my life. I like my McDonald's, blah, blah, blah. And I'll just get a cataract operation. I'm like, great, do that then. That's okay. Fine. But for the person that wants to avoid cataract operations, this is a way, if you catch it early enough, that you can alter the course of what's going to happen. And this is just through, really simple antioxidant therapy. And so some might actually know about this, some don't.
So when you're recommending this and somebody's like, yeah, that's me, I'm doing that, sign me up. How do you go? What's that process? Is it made for that specific patient, or is it a product that exists that you guys have to write a script for?
So it's a nutritional product.
Okay.
And so there's no, I mean, I do have drug writing privileges as a therapeutic optometrist.
Right.
But this is not in the script writing because you don't need a prescription for glutathione or NAC. And so I use a particular formula, and I note where the person's going and what their visual acuity levels are. And then I say, there's a incipient or a beginning cataract here. You got some choices. What would you like to do? You can just wait and have it taken out when it gets so bad that you can't see anything, or you can try and influence the course of the cataract progression. What would you like to do? And people say, well, what does that mean? What does that look like?
Right.
And so what it looks like is them putting drops in their eyes that are right next to their bed, and they go to bed and they put a drop in, they close their eyes and they go to sleep. And then they get up in the morning and they put a drop in and they close their eyes for about a minute, and then they wipe their eyes and they go about their day. And so I usually think that you need about 4 to 6 months before you're going to see a reasonable change. And so I sell them a bottle of drops, and actually 2 to get through to 6 months. Yeah. And then I call them back in 6 months and I go, what do you think? And I hear all kinds of things. Yeah. Like one of the things I heard was, the world doesn't look yellow anymore.
Hey, that's a beautiful thing to hear.
It's a beautiful thing, right? Yeah. Or I'll look at them and I'll say, you just gained a line of acuity on the chart.
Yeah.
So cataracts are big. And they're primarily lifestyle. If you talk to a medical doctor who's a surgeon who takes out cataracts, they're going to tell you it's just a matter of time. Everybody gets cataracts. And I would say, well, it's a matter of time and lifestyle.
Yeah.
Right?
Yep.
Not everybody, but most people, because they don't have a handle on this functional medicine lifestyle that you talk about all the time.
So there's one other thing that I'm wondering about. And I had texted you about this a couple of weeks back, but I was wondering about floaters, these things that people see in their vision that just kind of swim across the screen, so to speak.
So a couple of comments there.
Yeah, what's going on there?
A couple of things. Number one is floaters can be innocuous or not.
Okay.
That's the or not part. And you know how it is.
Mm-hmm.
You do your job, you do it well. All the docs that are listening to this know what I'm talking about. You're doing your job, you're doing it well, and it can be a level of routine.
Mm-hmm.
And then Friday night at about 5 o'clock, in walks an emergency, and you better be prepared.
Mm-hmm.
And so that's why you have all the training you do. It's not for the easy ones. It's for
Right.
the ones. It's for the hard ones.
Right.
And so floaters can herald a problem. They can herald a retinal problem. So you can't just go, oh, it's a floater, no big deal. Have someone check this out who's got an eye doctor degree, that can look at it and reassure the patient that it truly is just a floater. And when I say just a floater, that's what you want to hear about, correct?
Yes.
Okay.
Yes.
All right. So
here's why. Because you get so many patients that have chronic disease, especially diabetes, where there's a whole bunch of oxidative stress, etc. And it's one of the things that I commonly hear about are the floaters. Doc, is there anything we can do about the floaters?
Maybe.
Right.
First of all, an understanding of what it is, because the why equals the help, right?
That's right.
And so a floater is formally called vitreal syneresis. Isn't that fancy? And vitreal syneresis just means a liquefaction or a liquefying of the jelly part of your eye that exists from the crystalline lens all the way back to the retina. And so as you age, that process that makes the vitreal humor or the jelly part of your eye turn to liquid will expose and clump together the strands that are called fibrils. They'll clump together and they'll cast a shadow on the retina. And that's what a floater is. So there's different classes of floaters. Some look like cobwebs. Some look like lines. Some look like dots. Now, the vitreous is attached to the retina in various places. And sometimes that attachment gets loose and it'll actually pull off of the retina. It's not a retinal detachment. It's called a posterior vitreal detachment. We call them PVDs. And so when you have a PVD, it's an enormous floater. It is humongous and it's very disconcerting because all of a sudden there's this huge big black spot in your eyesight. Like, holy moly, what is that? Sometimes a shower of vitreal floaters can herald a retinal detachment. So you can't always say it's just oxidative stress. Sometimes there's something really serious going on. But when and the vast majority, that's not the case. The vast majority, there's just a process of aging. And as you say, it's likely has a big old foot in the well of oxidative stress.
Yeah.
It's accelerating. So does oxidative stress accelerate the aging process?
Yeah.
Pretty sure the answer is yes. And if the aging process includes liquefaction of the vitreous humor, then I'd say oxidation is directly related to floaters in that jump. You follow, of course.
Yes.
And so they're annoying, but two things happen. Number one, gravity does its thing and it'll sink out of your line of sight over time.
Yeah.
That's always very useful, but new ones form, which is annoying. That's number one. And number two is the psychological principle of stimulus extinction. If I clap my hands a foot away from you, how many claps would I have to do before you ignored me?
Right.
So stimulus extinction, right?
Yeah.
And so those two things happen. So there's not great evidence for immediate treatment. The medical treatment is to take out the vitreous of your eye.
Right. Suck it
that
out.
Seems, come on, that's a little bit invasive, maybe. And so a long time ago, I was talking to, that every nutritional company has their quote unquote hero that they put out that represents that nutritional company. And I was talking to one of them, this was probably 2005-ish, and he said there was an old ophthalmologist that used to take care of floaters by using bioflavonoids and hypothalamic and pituitary neonatal tissue.
Interesting.
It was. And I've tried it a couple times, and well, probably more than a couple. And it's a kind of a hit or miss thing. Some people phenomenal, other people like, meh, meh. I didn't get anything out of that. So, but it is something to give a shot, depending on the level of annoyance of the person. Some people are just annoyed and they can do their life. Other people, man, the floaters are so bad they can barely see.
Yeah.
So it just depends on the person and what you're trying to do. So there might be a potential nutritional solution, but generally it's, and then of course the other thing is, once you clear up the oxidation, once you clear up the oxidative stress, because that'll slow down the liquefaction process. Because it's part of the aging process. So, maybe a step removed, but a really, really good idea, right?
Yeah, that's right. So the thing that I appreciate about your viewpoint on a lot of the things that we've talked about today is that it's not replacing the allopathic approach with something that's natural, like nutrient for a problem. It's systematic in nature. Absolutely. and it's ground up. And I think that that's a thing that in the next 10 years in healthcare, you're going to see more people learning this and deploying this, right? As if it's something that's groundbreaking and new, but yet here you are since 1999 laying it down. So I think that's amazing. So anyway, I appreciate
it. And I'm appreciative to be in my spot, and it's a good energy to have. Just be appreciative of where you're at in life, because it could be a lot different. And I give myself credit too. I went and got it, and I learned. But I'm also like incredibly blessed to be in the position that I am, to help people and to have the tools available to me, and to help other docs. If they run into a problem, I am so available to talk. I am willing to share anything and help people do better with the patients that they're trying to help.
Well, speaking of which, where can we find you online, and where can I direct people, like to your website or anything like that?
So my website, I actually have two websites, because one is nutrition and one is neurooptometry. So my nutrition website is 7 Steps to Health, the number 7, the word steps, the number 2, and health.com, 7stepstohealth.com. And then my neurooptometry business is iBrain Connection. And so iBrainConnection.com. And emails are info at 7 Steps to Health and info at iBrainConnection.com. And that's how I
Very good.
Reached.
Well, I'm going to include those in the show notes here. And that's great. I appreciate you making yourself available like that. The other thing I have to ask you is this. I want to do a part 2 with you at some point, because an hour is not long enough to unpack the questions that I have here. And
there's a bunch of stuff that we have not talked about. I
exactly. Agree. So would you be willing to come back and visit with us again?
Without question. This has been great. It's been fun. You're an awesome host, and I love the work you're doing.
Well, thank you. So, all right. Well, you guys go check out Dr. Terry Trinka, and we'll have him back on the Nutrition Hero podcast here again. But I thank you for your time today and your attention and spending some of that with us. I know you're a busy guy, so thank you very much.